Hi, this video is the art of hair transplant restoration surgery result for 1 year, not result, actually the before surgery. And this is the demonstration of receding hairline and corner. And basically our goal today is to lower the hairline. And we're using the FUE method. Yeah, this gentleman liked to wear his hair short on the side and then fix his hairline to leave the top a little bit longer. And once we lower the hairline, it will completely drastically change the face. It framed the face better and enhance the eyes and nose and all the features that God created. Again, FUE is the most advanced technology. It leaves you minimal scar, allows you to wear your hair shorter. But it's not just minimal scar, but it's less invasive, less bleeding, less chance of infection. So FUE is the future. The strip is still, I still do the strip, but it's fading out. It's only reserved for a guy with advanced hair loss where you need to move like 4, 5, 6,000 grafts per day. This gentleman, probably 1,500 to 2,000 grafts. It just depends how much density and how low the hairline and how big his hair, his head too. But the demonstration of the hairline from the mid eyebrow to the hairline for Caucasian is around 7.5 to 8.5 centimeter. For Asian and Black, it's around 6.5 to 7. This gentleman actually his is around 7.25. And again, we just base an average, but when I create the hairline, I build according to individual facial structure, as long as a third and a third and a third and a proportional. And because he has a narrow face, so we arch up a little bit. Now, even though it looks arch up, but when the hair comes out, it actually looks a little bit more almost straight, but it's not. There's an illusion how we create it too. And how's that? Because we have a smaller zigzag here and a bigger zigzag on the outer, and then the bigger zigzag, the hair will lower on the outer side, so it kind of gives a different type of hairline. So once we get the shape down, we transplant at 35, 45 in the front, increase when you go backward, and change it when you go a different direction. Not only the precise angle is important, the selection of hair grafts is important. We transplant rows and rows, single hair graft in the front, followed by root to grow 2 hair, 3 hair, and 4 hair in the back for bulk and volume. Because the front you want softness and naturalness, the back you want density. And then no hairline straight, so we have a zigzag as I mentioned. But we have 2 or 3 type of hairline. And in terms of, there's a tight hairline with a smaller amplitude zigzag, and then there's a soft hairline with a bigger zigzag. Now, there's no right or wrong answer. The tighter hairline, more celebrity like that. Why? Because they want more bring a wow factor. So it use less of a single hair graft, and the thick root is closer to the front. So it gives an impression of more density. Again, it draws more attention though, and some people might not like it, but some people are okay with it. Now, it's still going to look natural. It doesn't matter which one. Then there's a soft hairline with a bigger zigzag, and so then it's more conservative personality. You say, I don't want to draw attention. I want the most natural, but I don't want to draw attention to my hairline. But the downside of the soft hairline zigzag is it looks less dense. Although the density is good, but it just looks less. Why? Because we use a lot more root to grow single hair in the front. So the patient can decide that on surgery day, or you can have somewhere in between. So call medium tight if that's what you want to do. And this gentleman liked to have a little mild, small widow's peak, so we come down and do that. And now it looks sharp right now, but when the hair comes out, it's gonna look a lot more softer and more natural. So I'm excited for him because in a year time he will look different. He's already a handsome guy, but once you have the hairline down and frame, the face will completely change. It will gain 10 to 20 years of his youth back. Not only his youth, but his look, his eye, his nose, and I'm excited for him. So starting around 1,500 to 2,000 grafts. Stay tuned.